See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
The very first component of the program speaks to the importance of fathers in the lives of their children. Fathers love their children, and they want to be involved in their children's lives. A key element of innovation is talking to the people you are hoping to work with.
Welcome to See You Now. I'm Shauna Butler. Fathers play a unique role in their children's lives and development, and plenty of research backs up the importance of a father's presence in a child's life. Just ask the experts, kids, and they'll be the first to loudly endorse the dad effect on their lives, well-being, and confidence. But when it comes to preparing for parenthood, the focus and lead role is heavily skewed to preparing mothers for motherhood. The body of research encompassing responsible fatherhood indicates that involved fathers, whether living with or apart from their children, can help foster a child's healthy physical, emotional, and social development, help mamas to thrive in their parenting role, and involved dads tend to be healthier, happier, and higher achieving themselves. So how are fathers getting the attention, support, and training they need to be successful? What do they need to be successful? And much more urgently, what do they need to be successful in this age of pandemic parenting, when fatherhood means being dad, teacher, and friend? And how does all this come together with the additional complication of being a father who isn't living with their children? It's not easy. Nurse scientist and researcher Wrenetha Julion asks this question every day and has taken a keen interest in a particular subset of fathers who need an extra level of support. In this episode, we zoom into Chicago to chat with Wrenetha about how she is innovating to connect with fathers, to help families, to build bridges, and keep up with them, even as so much around them is crumbling under the weight of a global pandemic.
My name is Wrenetha Julion. I am a professor and the chairperson of the Department of Women, Children, and Family Nursing at Rush University College of Nursing in Chicago. I am a researcher who has focused on the health and well-being of families, in particular, a special emphasis on the importance and well-being of fathers. I myself am married with 3 adult children, so I figured it out. We stumbled through, but I am someone that's just really passionate about the importance of family and recognizing the multiple constraints and the societal issues that make it really difficult to raise children. And that doesn't have to be.
You are a nurse at a remarkable moment, and the work that you have been doing in thinking about parenting and families and children has never been more timely. Would you agree?
Yes, I would. This time that we're in is more difficult than ever for families, and challenges that we never thought we would have to face in terms of families and supporting families. And quite honestly, if I were a parent with a small child right now that I had to homeschool, that would be a huge lift for me. So people are working from home, schooling children, taking care of family and elders. And this is truly a remarkable time and a really difficult time for a lot of people.
You are one of the founders of the Chicago Parent Program and running a lot of research based on the experiences that you're having, collecting data. But this is also, the Chicago Parent Program is an evidence-based program. Share with us the magic of the Chicago Parent Program. What does it look like and how are people experiencing it?
The families that we support through that program are not the heavily resourced families that can call up the family counselor or bring in the nanny to help manage the children. So our families are working families, and the access to available supports such as parent training is limited, which is the impetus behind the Chicago Parent Program. It's why we started working in low-income daycare centers and why we're in the community, because we believe that all families should have access to these types of resources. The magic of the Chicago Parent Program is that the model that we use as group leaders is a facilitation model. And this taps into the thinking that we're not the boss, we're not the leaders, we're not expecting you to sit and listen and take notes and go home and do what we tell you. What we've learned through our experience is that parents have a wealth of information and they learn a lot from each other. So I'll give an example. In group settings, parents may come up and have a particular challenge with their child, and they will ask the group leader, what should I do? How should I handle this? And it would be really easy to say, this is what you should do, steps 1 through 3. But instead,
wouldn't that be nice if we had that easy manual and a recipe? Yeah.
Exactly. So my husband calls our firstborn the test dummy because, it's meant affectionately, but she's the one we learned on, we figured it out with her.
Yeah.
So what we would say in a group would be, okay, what does anybody else think in the group? Has anybody else had a similar experience? What have you done? What do you think that this mom should try, or what do you think that she should think about? And so it's something that really embraces the entire group and breaks down that teacher-student dynamic so that there is this collaborative spirit between everybody in the room. Because you have some parents who have multiple children of different ages, and you may have some parents who this is their first child, and the sharing in the group is one of the most outstanding and amazing components of the program.
How did you develop this interest in wanting to focus on parenting, and particularly thinking about dads?
I spent 8 years in the NICU, neonatal intensive care unit, with really small babies and really sick babies. And that was the highlight of my nursing career. Loved every minute of it. But I also started thinking about, what will parents need when they get these children home? And some of the children have complex health conditions and are going to need a lot of resources and a lot of services. And a lot of times in the hospital, the focus is on physical care. This is how you feed them. This is how you give them medication, those types of tactical skills. But nobody talks about parenting skills and discipline and being effective in helping your children learn and helping your children grow up to be healthy. And that viewpoint mixed with my thinking of, why are so many babies being born and delivered and end up in the NICU? So that spurred me to think about what's happening on the outside in communities before families get to the hospital setting. And there are a lot of challenges and strengths and communities. But I felt like an area that I could be helpful is in supporting families and in supporting parents. So I ended up back in school in the PhD program at Rush, working with Dr. Debbie Gross, who is the first author of the Chicago Parent Program, who's been doing this parenting work for a long time. And the first grant that she had is when I started working with her, and we were using another parenting program because the Chicago Parenting Program didn't exist. And what we learned from that was that our families did not connect with the families on those video scenes from that other program because they were families that look so different than themselves in communities that look so different than their communities. And that was really what made us decide to pursue the funding to develop and to test and to implement and to disseminate the Chicago Parent Program, because we believe that families learn better when they can connect with the families that they're seeing and with the situations that resonate with their own lives. So that's how I got involved with the research related to the Chicago Parent Program. And it was really at that time that I started paying attention to what parent training programs focus on or who they focus on, and it's primarily mothers. And at that point, I knew that I wanted to focus on fathers. A little further down the line, I realized that the fathers specifically that I wanted to focus on are the fathers who do not live in the household with their children. So that's my journey to really where my interest lies on an ongoing basis now is the importance of supporting fathers and fatherhood in settings where they are given little attention and little positive attention. In particular, if you hear anything about fathers, it's usually something negative, which is so frustrating and so short-sighted.
Paint a picture of what this parenting program looks like if you are a participant. Who are the people that are in the room? Why are they there? How did they find out about the parenting program? And how often does it meet? What formats are you using? Share with us what that looks like, what it feels like even.
We had space in the daycare center for our meetings. We had childcare provided by the daycare center staff, so the children already knew them. And we provided meals for both the parents and the children, so that it was sort of a one-stop where parents came in to pick up their children. They stayed for the group meeting, which was about 2 hours long, and their children were happily playing with someone that they were comfortable with in another room. Everybody got dinner, and then they went home and hopefully were just able to put their little people to bed and call that day done. The group is set up in such a way that it uses videotaped scenes to really jumpstart the discussion with the parents. So it's an interactive format, and again, not a lecture of telling parents what to do. We filmed video scenes, short scenes that last anywhere from 30 seconds to a couple minutes of parents engaging with their children in situations that our parents in the group can really relate to. I'll give an example. We have a scene in the laundromat where the mother is trying to get her laundry done and her toddler wants to run around the laundromat. So we worked with families to create this program. We hired them as actors, but they were really families, and we filmed them in various settings. such as the laundromat and in the daycare center and in the community.
I hope you got one in the grocery store. That is always my favorite
Oh,
experience.
yes. we had, but it's the well, I don't know. We had a meltdown in the grocery store.
Mm-hmm.
So we did have a bit of a tantrum in the grocery store. And then we had some really beautiful scenes in the grocery store of a parent using a strategy called descriptive commenting, where she's describing what her child is doing as a way to help her child learn.
Mm-hmm.
So we had both. One of my favorite scenes is the temper tantrum in the laundromat, which we couldn't have tried this intentionally if we wanted to. It just happened spontaneously. And this mom did a beautiful job of distracting her child, bringing him back in with her and the older sibling. And when parents see these scenes, they can see examples of their lives and things that happen to them. And after that, we show a scene, we stop the videotape and we ask a set of questions. We ask parents, has anything like that ever happened to you?
I would imagine that there is this outburst of knowing laughter.
Yes. Yes. And I think what's important is that with the sharing nature of the group, the parents are comfortable saying, yep, we just had that happen yesterday. And when we're asking questions, then parents can then say to each other, okay, this is something I'm going to put in my bag of chips because my child is known for having a full-blown meltdown in the grocery store. So they see strategies firsthand and then have the opportunity to go home and practice those strategies with their children.
The observation that you had while serving in the NICU about you're wondering why families and these babies end up in the NICU. What's happening that leads up to that? And then when they need to go home, understanding that beyond the just basically you need to keep this kid alive, the social and emotional learning. When you started digging deeper into those details, what did you see in the family lives and in the community that you are thinking leads to a birth that ends up in the NICU?
I struggle a little bit with that question because I think there is the opportunity for blaming, and that so much of what goes on in the community gets portrayed as people not doing what they should do or people not doing what healthcare providers tell them to do. And in my mind, I believe that families are doing the best that they can with what they have. I think that there has been a history of discrimination and racism that contributes to disparities or differences in health, differences in healthcare, differences in health outcomes for poor and minoritized communities. So it's difficult to imagine, there are so many challenges in the community and so much that families face that's beyond what we could support in terms of helping families with their children. So I worry sometimes about the thinking that for any family who ends up in the hospital or ends up in a less than perfect scenario, that it's the family's fault or it's the parents' fault, because I think it results from gaps in everything connected to healthcare. And I think we can see that now in terms of coronavirus, the numbers of people who are most ill and the numbers of people who are dying are in Black and brown communities. And that's from a long history of ignoring the health and the safety and the well-being of those communities. So while it's important to know about the community so that you can have that connection with families and be able to support them, I think it's a delicate balance because you may think you know that community or that family or that situation, but until you've lived it, you really don't.
So what is the better, more helpful, more accurate question that we can pose that gathers the information around the communities that contributes to a NICU admission? And more importantly, what would we be asking so that what we're targeting is healthy outcomes, healthy babies born into families that feel prepared and supported to meet the challenge, regardless of where you are in the world and what your situation is. Parenting is just challenging. It is the ultimate leveling experience for all of us. We are not in control. That child is. What is that question that helps us to be accurate and do better? What would you like it to be?
I would like it to be, what are the social determinants of health that influence what happens with families and communities? And those social determinants include whether or not they live in an area where there are only corner grocery stores and no grocery stores with fresh fruits and vegetables, or either communities where the tobacco industry is disproportionately marketing cigarettes, or all the billboards in the community are advertising alcohol, and the education of the children based upon the resources that are provided to the schools in many communities are disproportionately unfair.
You know an awful lot about dads and fatherhood, and particularly in the Chicago area. What can you share about what you've learned and how you're innovating to support their particular set of circumstances?
In my mind, innovation means doing or changing existing paradigms, programs, situations to make them more useful. And so for innovating fatherhood programs, that means, what space do you need to be in so that fathers can be there? And how can you engage fathers in ways that they know that they're respected and valued? A key element of innovation is talking to the people you are hoping to work with, because their insights are really the most important insights that we can gather. One of the first things that I learned when doing the doctoral work that I did with fathers is that if researchers wanted to learn about fathers, they asked mothers. And so this second class information, if you will, was being used to inform what we know about men and about fathers. And so that was one of the first lessons that I learned, and that I knew is that it was important to speak to the fathers directly, to hear their viewpoints and to hear their perspectives and to hear how much they love their children. I had a paper called "It's Not Just About Mamas." And that was a quote that was taken from one of the fathers that I spoke to, because that is what they feel. They feel that there is an overwhelming focus on mothers and children, and fathers aren't considered important enough to engage with, which is so painful to hear. So painful to hear. Fathers love their children and they want to be involved in their children's lives. And many of those factors that influence families weigh even more heavily on African American fathers. They are, I would say, most marginalized, most given the bad rap, and most treated despairingly than anyone in the community. And I think the first point to remember is that not in the home, it doesn't necessarily equate to not in the child's life. I worked with a group of fathers who are non-resident dads to develop Building Bridges to Fatherhood. And the very first component of the program really speaks to the importance of fathers in the lives of their children. And why we felt that that was so important to talk about first is that it's in the media, it's in the news, everybody's talking about fathers not being there for their children. And when men are hearing that message, I think some fathers question whether or not they are important to their children, whether or not they, mom is doing a good job, the child looks healthy, and okay, maybe I'm right, maybe they're right, maybe I'm not needed, maybe it's not important that I'm there. So the very first component of our program is to lay out to men why they are important in the lives of their children, why their positive involvement makes their children happier and healthier and gives them a better outlook on life. We helped fathers understand what they do differently than mothers and how they help children in ways that are complementary to the ways that mothers support their children. So I think that was really a really important component of pulling that program together, was to help fathers understand why fathers matter.
Preparing for this had me in a really sensitive space. And I think we all go back to the relationships that we have with our fathers. Not all of us had the blessings of a great father, or their participation that was helpful.
Mm-hmm, mm-hmm.
And so I'm feeling very sensitive for the people who would be listening and thinking how much they wish that they had that.
Yes.
And that becomes a very strong motivation for being the parent that they didn't get.
Yes, it's such an interesting dynamic for those fathers who grew up without their own fathers, because some it was a motivator and others it just seemed to be, it just kind of stopped them in their tracks.
The program, the Building Bridges to Fatherhood, that's an important innovation that you have brought to the parenting landscape. To your point, we do hear a lot about mothers. That seems to be the dominant part of the conversation. Describe that space, from the standpoint of who's teaching fathers. Do we need to be doing more?
Yes. I think that I have to be honest that one of the challenges that we had implementing Building Bridges to Fatherhood was fathers being able to participate in spite of the multiple challenges that they had going on in their lives. Their schedule changed. They can't get that night off to attend the group anymore. They have a short-term job, or something happened and they signed up, but they weren't able to participate. So we did not get the participation that we would have liked in the program, and that's something that we're still working through. But one of the other initiatives that I'm working with is to think about what's the best mechanism for reaching fathers and connecting with fathers. And so this is hot off the presses. that myself and a colleague, Paul Florsham, at the University of Wisconsin, Milwaukee, have just gotten funding to implement a program called Father Inclusive Prenatal Care. And this program will basically, at a time when fathers are super excited about that new baby that's coming, have fathers come into the prenatal care setting with the mom, but not your typical way of having fathers come in for a prenatal visit and sit him in the corner and focus the attention and all the questions and everything on the mother and not even look up and pay attention to the father sitting there. Our inclusive model of prenatal care will include an assessment explicitly for the father. What's going on with you? How's your health? What do you need? Do you need supports? Are you in school? Are you working? Do you need job skills? So I am really hopeful that that model can be something that would be really could be implemented in any healthcare setting where women come who are expecting children, because that's just the golden moment, really, when you think about this dad is there and he's excited about this pregnancy, but you have him come in and he gets his own assessment and he gets his own resources and he gets his own support beyond what is offered or provided to the mother. So we're really hoping that this model can be a gateway for getting men into healthcare services, social services, educational arena, job skills. So really excited that this is something that we're going to have the opportunity to test out.
Can you describe the Building Bridges to Fatherhood program and this Father Inclusive program? What is that program? What does it look like? If I'm a dad in this program, what am I going to experience?
The format of it is set up parallel to how the Chicago Parent Program is set up. It was designed with 9 group meetings to have dads come together to meet in a group setting with a African American male facilitator who would then run the program, which looks like showing a scene, stopping the video, and asking dads about their experiences and saying, how do you think the dad in that video handled that scene? What could he have done differently? What could he have done better? How might you have handled that? And it's the same format of having fathers really support one another and us not being the expert to answer all the questions, because if we give the group a chance, then they often have the answers, and we're just really giving them the confidence to realize that they do.
Is this a mom-free zone?
Yep.
Is
It's a mom-free zone.
Is this important?
Absolutely. Absolutely. It's interesting, the whole question about a mom-free zone. And as a woman, I had to ask, am I welcome in this space?
That's where I was going from the standpoint of, here you are, the primary researcher, don't want to be the expert, don't want to be telling you what to do, but you're not a dad. How does that work?
Right. Exactly. So, I think that I've managed to communicate to them by the work that I've done that I am committed to them, that they are important, and that they deserve the care and attention that mothers receive. And I actually had, when I did a pilot test of Building Bridges to Fatherhood, I had a question of the little pilot group. I said, what do you think about a female facilitator of this program, or a woman, being in the room? And so I had mixed responses. I had some fathers who felt like only men can really understand what we're going through. And I had others who felt like someone who had the right tone, who wasn't a man, and who was there for the right reasons could be acceptable. Now, when we tested the program, all of the group leaders were men. So while they know that I'm, basically in charge of the research, I was not in the group meetings. There were African American men leading the groups. And I think part of the challenge is that both for mothers and fathers, there is parent bashing going on. Moms are saying, he didn't do this, he didn't do that, he was late picking him up. And dads are saying, she's so unreasonable, she wouldn't let me see him. So while I recognize that co-parenting is important, I do think that there needs to be a safe space for fathers to be able to feel comfortable talking about what's going on and strategize among other men how to address it.
Thinking about how we're going to innovate in the parenting space, COVID right now has just dramatically changed our ability to have the in-person groups. What are you using? How are you innovating to meet this particular moment that is, it's never been more critical to have parenting support and parenting teaching, but you're really having to innovate and figure out how we're going to do this differently to deliver these very effective programs.
I think that we are contributing to the Zoom fatigue of everyone right now, which is really our best opportunity to bring people together in a way, although virtually, it still can provide a supportive environment, particularly if you have your cameras on and you have other men that you can still establish a relationship with. You've got a series of group meetings, and so you look forward to, okay, James, let's see how James did this past week because he was supposed to have his child over the weekend. Let's see how that went. And so I think those men are thirsty for those connections with other men. One of the strong findings from my research is that there is no natural place for men to establish those connections. Women are more likely to establish them in the church or in the child care setting, in the daycare. There's been some work that's looked at fathers connecting with other men in the barbershop, but it's not a weekly, you don't go to the barbershop every week, so and it's sporadic and it's not systematic. So,
and we're definitely not going to the barbershop right now.
Exactly. So I do think that this is an opportunity that we're going to have to include parenting in our new grant for Father Inclusive Prenatal Care, but we have to move it online.
What does the language look like to support people in their struggles and to help them feel like you're doing a great job? And yes, it's a struggle and you're doing a great job. What does that language sound like?
Part of that language is a hard look and a difficult conversation of, are you putting your all into this? Are there opportunities for you to do more or to do different? And to think about what those opportunities are. I think everyone needs to recognize when someone is really trying their best, but I also think it's about calling out, I think you could do better than this. I think you could do more. And here are some strategies to think about using to be able to get to that place. So it's a mix between recognizing what someone is doing well and then providing them with additional information on how they might be able to strengthen what they're doing.
There's a body of research, and I think you've been a huge contributor in this, on the importance of fathers in the lives of their children. The difference, the very specific difference. Based on, first of all, what's in that research, and how does that translate into what you would like policymakers, program developers, communities, parents, what should we know so that we feel very committed and connected to, we want to make sure that fathers are confident and competent and active in parenting their children?
I think we've learned from the literature first that men who are fathers and are positively involved with their children are healthier. They themselves are less likely to become involved in activities that would somehow distance them from their children. But in terms of what the children get from that involvement with their fathers, really at a level of social development, they learn how to engage. So it adds to their bag of tricks in terms of engaging with people in their lives. It also adds to their academic well-being. Children with actively involved fathers do better in school. They learn better, and they learn different, which I think is important. So not only is it helpful to fathers and to children, but it also provides that well-needed support for mothers who are working really hard, and to feel like you are alone in this job of raising your child, and to feel like you are 100% on all the time with no break, with no relief, with no support, is a difficult space for mothers. So really, it's a win-win-win for fathers, children, and mothers when that co-parenting relationship really is used to surround children in ways that help them to develop physically, socially, emotionally, and also to do well in school. One of the most important messages is to recognize that healthcare providers and those in social service settings have not necessarily been trained to engage fathers. There are old biases and old thinking about who fathers are and what they do and how they do it. And if I could really just boil this down to one thing, it would be to support the re-education of every provider who comes in contact with families, to recognize the value of the entire family, the importance of fathers, and to give these providers and healthcare people the skills that they need to learn to do this. Because this is going to take learning and changing of old behaviors that people have had for years. And if we can get across the value of this work and why fathers are so important and why they should be supported in taking care of their children, that's one step. But the second step is helping people learn how to effectively engage with fathers and to overcome their hesitation, if you will, not knowing what to say, so they don't say anything. And so I think that if we could provide some changes to a healthcare setting and a healthcare interactions where providers are comfortable in the quote unquote maternal child setting, engaging with men, engaging with fathers, and recognizing them as a part of the family and of the family structure and system that's going to help this child be healthy.
Nurse scientist and researcher Wrenetha Julion is professor and department chair at Rush University College of Nursing in Chicago, Illinois. For 30 plus years, she has been a dynamic advocate for addressing health disparities, inequities, and social injustice. Since the early 2000s, she's been using her skills as a nurse, educator, researcher, and mother to find ways to build and bolster the positive involvement of Black fathers who live apart from their children. She's the co-creator of the Chicago Parent Program, a nationally recognized parent training program for at-risk families living in low-income ethnic minority communities. NIH provided a grant for Wrenetha to develop the Building Bridges to Fatherhood program. And as you can hear from the excitement in her voice, she's about to launch a Father Inclusive Prenatal Care program that throws some much-needed love, attention, and support on soon-to-be dads during the prenatal care of their soon-to-be-born children. A few years back, the U.S. Census Bureau reported that 57% of African American children lived without a biological father in their home. The figure for white children was 18%, 32% for Hispanic children, and 11% for Asian children. Against that backdrop, researchers report that African American fathers often suffer from the misconception that they don't want to be engaged in their children's lives. But the truth and data, as Wrenetha reminds us, is that many of the non-resident fathers want to be involved with their kids' lives, and that a host of really complex factors get in the way. Wrenetha knows and shares that non-resident fathers really love their children. They want to have fun with them, see their kids grow, play with them, watch them learn, and help them thrive. You know, in all the challenges and hurdles parents can face, sometimes we forget just how much fun and funny parenting can be. Something that Kiwi bloke and dad, Justin Watson, reminds us in his hilarious, charming, and highly informative How to Dad videos. You know, if you're wondering about all your options to hold a baby or to put one to sleep, be sure to check out Justin's clever variations. Wrenetha's focus on fathers in no way shortens the lens on mothers and the very taxing and intense nature of responsible motherhood. Instead, it widens the aperture to include and integrate fathers in parenting from conception to birth and far, far beyond. Instead of preaching as teaching, Wrenetha's work builds on what fathers instinctively know and helps them to develop tools together, building not only bridges, but villages, very happy and very healthy villages. For See You Now, I'm Shauna Butler. Thanks for listening.
Subscribe to See You Now wherever you get podcasts, and we'd so appreciate it if you share the show with your friends. It really helps us out. And if you have a moment, drop us a line and let us know what you think of the show. hello@seeyounowpodcast.com. Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance health care for all. Learn more at seeyounowpodcast.com.